Hi, my name is Dr. Patel. We are here at my practice called The Tooth Experience, and we are going to talk about the proper ways to take care of our teeth. One of the biggest misconceptions is that just brushing or just flossing takes care of all of our issues, and that is incorrect. The reason why is we want to make sure we are brushing our teeth properly and using the proper techniques to do it. A lot of things that I notice that they're missing is they forget to angle their toothbrush towards the gums. If they're flossing, they're just flossing to get it done. You really want to make sure you are using the tools in a correct manner. That way we can really get our teeth clean the way that it needs to be, because our mouth is the stepping stone into the rest of our body. We are eating, drinking water, all of the bacteria that are in our mouth really can go into the rest of our body and play a big factor there. So we want to make sure we are keeping our mouth, our teeth clean. That way we don't lead into any kind of infections or things like that. So we are here at the Tooth Experience to kind of help our community to make sure that they're doing the things that they can to make sure they don't have to come into the dentist for emergency tooth pains, stinky breath, things like that. Most common cause of stinky breath can be diseases like gingivitis, periodontitis. They're mainly caused because we have plaque and tartar buildup over longer periods of time, and people are just not brushing and flossing correctly. That can lead to a more chronic condition like periodontitis, and so that's where the deeper cleanings and things like that are going to be necessary, and so we want to try to avoid that before we even get there. So gingivitis is when our gums, our tissues get inflamed because of bacteria and plaque and tartar being built up around our teeth. If we don't take the proper precautions to take them off, the tissue get annoyed and get inflamed and cause us to lead into gingivitis. So preventing gingivitis is pretty simple. It takes a little bit on the dentist office part and a little bit on the patient's part. You really want to make sure you're coming in for the 6-month cleanings, following up with your dentist, making sure you're doing everything you need to. And then on the patient's part, we really want to make sure that they are taking care of their teeth properly, using proper toothbrushes that they need, using the proper techniques to floss and things like that to kind of make sure that they're doing the proper home care that their mouth needs. So proper home care, you really want to brush 2 to 3 times a day, ideally 3. You want to brush after every meal. You want to brush in circular motions, kind of aiming your toothbrush towards the gum line, making sure you're getting all the food particles, all the bacteria out of there. After we're done brushing, we want to floss. You kind of want to angle them to kind of the teeth, and you want to use some kind of mouthwash or some kind of antiseptic to kind of clean everything up after that. Common bad habits that I see with keeping up with bad hygiene, I commonly see that people are just brushing the tops and the sides of their teeth. They're not really angling properly, not using circular motions, not using a soft bristled toothbrush. That also plays a factor. We don't want to be too hard on our teeth either. We want to make sure we're brushing just right. So with flossing, you really want to make sure you're paying attention to the anatomy of the tooth. A lot of people try to floss straight down into the gums, but you really want to kind of C-shape it towards the teeth and really get into the sulcus of the teeth where the gums and the tooth meet, and keeping everything nice and clean. Again, my name is Dr. Patel, and we were here at the Tooth Experience. We're talking about some of the hygiene issues that I see on a daily basis. Make sure to like, subscribe, and hit the notification bar so you can learn more about dentistry and why it's necessary.